Thanks for inviting us in. Families are packing up and heading out of town for spring break, and it seems to be the perfect time. COVID cases are down, restrictions are lifting left and right, but doctors are warning another surge could be right around the corner. So tonight at 11, we want to dig into this new Omicron subvariant and how cases here in Indiana compare to the past couple of years during spring break season. But first tonight, our Lauren Kostick shares tips from doctors on how you should stay safe during your family's trip.
Spring break travel is picking up as COVID restrictions are lifted and popular destinations are booked. It all comes as states see a drastic drop in cases.
We're watching the numbers each day. We're really happy to see them as low as they are, so that's great. Again, we'll expect a little bit of a bump, but I don't expect anything drastic.
Like many health officials, Shandy Dirth with the Fairbanks School of Public Health is preparing for the slight increase in cases, reminding Hoosiers to not let their guard down.
COVID is still there. We haven't eradicated it, but the numbers are definitely better. And again, we still encourage everyone to be vaccinated and boosted.
Despite this surge in travelers, many businesses and resorts lifted their mask mandates. But the TSA extended its mandate another month after it was set to expire in a few days.
If you're traveling through or to a place with medium or high transmission levels, you might want to consider wearing a mask too.
That's because after last year's spring break, Indiana saw a jump in cases. At one point last March, the state was reporting more than 1,000. Now that number is less than 300.
I think we're in a better spot right now for a spring break.
But Dr. Belcher says it's still important for families to be prepared. That means if you are eligible, get vaccinated or boosted. Also look at the COVID infection rate for your destination. Try to limit your time indoors and in crowded spaces, and get tested before and after traveling, whether that's an at-home test or in person.
So it should be pretty easy, quick, painless to do.
As travel resumes to pre-pandemic levels, health experts say have fun, but also be smart.
This is now our third spring break season since COVID hit. So tonight I want to take a look back. Each year we faced very different scenarios. Remember back in 2020, the pandemic had just started. Reported cases were relatively low. Testing was very limited and cases were undercounted. Then back in 2021, this orange area highlights March and April. Cases were dropping as the vaccine rolled out. Now at the time, shots were available for everyone 50 and up. Now let's go ahead and fast forward to this year, and you can see we've seen a major drop in COVID cases. We had just come off that Omicron surge where we were reporting upwards of 10,000 cases almost daily, and you can see how far things have dropped. Our average numbers are now lower than they were at this point last year. Keep in mind, though, we are beginning to see cases spike in certain spots around the world. The United Kingdom is seeing infections surge by about 52%. Cases in China up 377%. Experts point to Omicron's subvariant, which is more contagious, but not necessarily more severe. Relaxed mandates and waning immunity from vaccinations could also play a role.
As travel and COVID concerns rise during the spring break season, the White House is warning it's running out of money for COVID tests, vaccines, and treatment. This is a result of Congress declining to add $22 billion in COVID funding to the government spending bill passed last week. So let's take a closer look at the impact. When it comes to treatments, we'll have to cut back the number of shipments for monoclonal antibody medications and cancel plans to buy more COVID prevention treatments for immunocompromised Americans. Vaccine-wise, we have enough doses to offer fourth shots to people with weakened immune systems, but if the rest of the country needs that additional dose, we might not have enough. We could also see fewer COVID tests being made and less surveillance for new variants. Right now, there are efforts to pass a standalone COVID-19 funding bill, but with little Republican support, it doesn't look likely.
Now, if your family needs to get a COVID vaccination before heading out on spring break, IPS is hosting a clinic tomorrow. It takes place at Crispus Attucks High School from 2:45 until 6. You do have to register online, and we've got a link for you on WTHR.com, along with the link to vaccine sites around our state. And that wraps up tonight's big story.